Okay. Hi guys, welcome to our Zoom meeting. I'm going to be presenting the name of the clinic, which is Las Alturas Nursing and Transitional Care. The setting is a long-term setting. The name of the PT or PTA interviewed was Ileana Juarez, and in this, she is a physical therapist, and the group members are
Brianna Garcia,
Xavier Rodriguez.
Ivana Sanchez,
Gabriela Gutierrez.
Okay, so here are the interview questions that um, were asked to the physical therapist. And right now I'm going to show you guys the video.
Hi, my name is Liana Juarez. I'm a physical therapist and helping out Ivana.
Okay, yes. I'm gonna ask you several questions, okay? The first one is, please state your title and primary role in the setting, which you already did. And number two is, how many years of experience do you have practicing in this setting?
Well, I've been practicing in this setting for about 4 years, but with geriatrics, the span, which is 8.5 years.
Okay. What is the total number of years that you've been practicing as a PT or PTA?
As a PT at 8.5 years, but always with geriatrics, and the last 3.5, almost 4 with the skilled nursing facility.
What appealed to you about working in this type of setting?
The elderly population, I enjoy working with them. They're very patient, and they're very grateful for us to help them with their mobility, with their pain, with their endurance conditioning conditions.
What is your work schedule, and what are some of your daily duties?
Okay, so work schedule, it depends, it's flexible. Some people start really early at 7 in the morning and they work their 8 hours, but we can treat 7 to 7, meaning 7 in the morning all the way to 7 at p.m. in the evening. You can come in later in the day and leave later, but it's up to you, and it's flexible in that sense. As far as my responsibilities, I'm a supervising therapist. I'm the only physical therapist at Las Alturas nursing home, so I'm responsible for all patients under physical therapy, as well as I supervise 2 physical therapist assistants.
Okay. Describe the type of patient population seen in this setting.
So it's diverse. We see patients recovering from stroke, from myocardial infarctions, from low back surgery, more orthos like hip replacements, total knee replacements, after ankle surgery, or other GI issues after gallbladder removal. We see them. We see variety in this setting.
Please provide some examples of patient diagnosed a PT or PTA can expect to treat.
Okay, so after Parkinson's is one of them that we do see, and you all can be expected to treat. We see people after stroke, neuro, not only CVAs, but also like myasthenia gravis and other neurological conditions. And also straight up debility and deconditioning, just age-related, senile age-related debility.
What is the usual patient caseload?
Okay, so that will fluctuate day to day. If you have groups, you tend to have a heavier caseload, but you'll finish in your 8 hours, because with groups you can have see multiple people, but you will end up with the same amount of time. I can see anywhere from 12 patients and have 8 hours, as little as 6 patients and still have 8 hours. Especially we're talking about evaluations. They take a little longer to complete. So it will fluctuate. At one point I've seen like 20 patients at some point, but that's not the usual. That's usually picking up a caseload if someone's out. But you have to be expected to be flexible, and know that that's not the usual. Some treatments are 15 minutes, and that's where you end up seeing a lot of people, but for less time.
Do you use support staff, and if so, what kind? PT or aides?
Both. So we'll even co-treat, or we'll work with occupational therapists, CODAs, PTAs, CNAs, anyone, even families when they were allowed, regularly in the facility, we would do family training. So there's a lot of education. So yeah, you can work with anyone, with a nurse to an RN.
What factors do you consider when delegating patient care to a PTA or aide?
Just making sure that they know the precautions, making sure that if they have any questions, we address it before they treat a patient. For example, with an ortho that's non-weight bearing, making sure it's communicated in the plan of care. If there's a risk for DVT, making sure that it's outlined, that they're very clear, whether it's sternal precautions, back precautions, high risk for falls if they have a history of repeated falls. I'm making sure that before I delegate something, they're really aware. Any wounds that they may have, anything that they need to promote the healing of the wound. So yes, when you're in charge of all the patients under your care, and also delegating those tasks to the assistants.
How do you supervise a PTA or aide?
Well, I can supervise them, and they're in the therapy gym. They're in the line of sight. So also, if they have any questions, or I see that perhaps they could do something differently, I let them know. If they're doing something great, I let them know. So it just depends on, but they're usually in the line of view. Unless there's in-room treatment since the pandemic, then if they have any questions, they'll come and ask me. They're very good. We try to keep that communication. We establish that communication at the beginning. So I also supervise their notes. I've got to sign off for them as well, especially with progress reports. I've got to make sure that I read them, because that's how I'm going to know that patients are meeting short and long-term goals.
What are some expectations of a PTA beginning to work in this setting?
Okay, the same. Maybe if they're brand new, we'll take care of them. We'll maybe lower the caseload, and making sure that if they have any questions, if they are having issues with time management, it's very important. When you have 20 patients and you need to get your 8 hours, you need to make sure that you're able to time manage everything since you get there. Because another thing is productivity. They really do look for productivity. And all that means is staying on task. So when you're a new grad, I think that's, at least when I was a new grad, that was one of the challenges. But they always took care of me by giving me less casework until I got into the rhythm. Things became more automatic as far as supervision or completing progress reports, research. And so for a new PTA, I would say time management would be one of the things that they're expected to work on. But being realistic, giving them the support they need to be able to get through a workday and meet all the demands of the employer.
Describe the importance of communication between the PT and PTA.
It's really important because it boils down to patient safety. So I need to make sure that if anything changes, let's say weight bearing status initially is non-weight bearing, I need to make sure that that's communicated. And if they follow up with the ortho and they upgrade the weight bearing status, I also need to communicate that, do another assessment, and see, how we're going to upgrade the plan of care. So it's very important to communicate. I want them to feel comfortable if they have any questions. So I always tell them to come, to ask. And if I don't know something, I'll find out. So yeah, it's very important.
How valuable is the PTA in this setting?
They're very valuable. I cannot handle the whole skilled nursing facility by myself. There's just no way. So they're valuable. If I know I'm gonna be short an assistant because they've asked for some time off, or all of a sudden, they need to take a day off, I make sure that I guilt the other PTA and be like, are you gonna be here tomorrow? Because I need you. So they're very important. I don't take them for granted. I appreciate everything they do. They're very hardworking people.
What changes have you seen in the profession during the time that you have practiced?
There's always changes. You have to be able to adapt, and you have to, I don't take change well, but when there are changes, we learn what those changes are. It takes some time to adjust, and then you just get into the rhythm. For example, the groups, they came back in the skilled nursing facility, less individual time. So we've learned to adapt. You can have a lot of fun in a group, but at first it was a challenge to get back into that rhythm. But because groups have existed in the past, they went away kind of, and then they came back. So you also have to learn the difference between a payer source, Medicare versus Medicaid versus managed private insurance. So that you will learn. You will learn as you go on to your professions or your different settings.
Mm. How has the field of physical therapy differed from your expectations before entering the profession?
Give me one more time. How has my expectations?
How has the field of physical therapy differed from your expectations before entering the profession?
I think they did a good job preparing me in physical therapy school. So I knew the patient population I wanted to work with. And so it doesn't differ very much from what I expected, other than the different types of settings. Like I've done rehab, skilled nursing, even the home health setting, all geriatric. So I just have to learn how each setting operates differently, whether it's the amount of minutes, less intense than skilled nursing facilities tend to be less intensive than rehab. So it's just learning the management, the operations of each one.
As a pre-PTA student, what practical advice can you give me regarding the physical therapy profession and the PTA role with the profession?
What advice can I give you?
Yes.
Don't be afraid to ask if you don't know something. Just be one that always seeks continuing education. You'll grow a lot by doing your CEUs. I can just tell you that prepare. You can get certified in something that you really love. You find an area. If wound care is your thing, then get certified in that. If taping is your thing, like get certified in kinesio tape. There's a lot of areas that you can become an expert in, and be very comfortable asking questions. Go back to your books, ask the therapist. We don't know it all either. There's some things that change, and we always need to stay on top or keep learning, And so that's the advice I would give you, is always keep challenging yourself. if there's a new diagnosis, a new method, a new way to do something, you will learn from each discipline too, like speech, occupation. You're not just working with a physical therapist. It's really a team to try to get this one patient given the best care they need and the support they need, whatever they need. So talk to everybody. You'll become a better therapist, better able to care and manage for your patients with more experience and by looking at different things that everyone's doing. So that's the advice I would give you is work with the whole team, be a team player.
Thank you. That concludes our interview.
Okay, so here is provided group reflective statement that includes any or all of the following. The setting will be to evaluate the resident and treat the resident as they should be treated based on their injury, surgery, and disease. Benefits of working in this setting. Benefits of working in this setting would be that the residents have management of underlying conditions. We try to preserve and restore function according to the underlying conditions of the resident. For example, chronic weakness, contractures, falls, and acute on chronic pain, which is major pain. Your impression of the setting. The impression of the physical therapist is that she loves to work with that group age. There's a group planning, for example, working as a team. Conclusions are drawn from this experience. A conclusion drawn from this experience will be that it is a rewarding job. There is challenges every day, and you must be ready for flexibility and to work in a team environment. Knowledge that has been gained with the long-term setting will be that residents are all being treated according to the goal that they want to reach. To always respect the residents and always try to educate them on how to improve. Also, to always document everything that occurs through the time the resident was taking therapy, for example, if they were cooperating or not. Now, Gabriela is going to be presenting her slides. Thank you.
So my summary of the interview and the highlight, at least the main points for me personally, were scheduled because I do have kids. So it's nice knowing that I can still have a good work to life ratio. The responsibilities, because it's always good to know what to expect and to better prepare yourself when you go into it. As far as time management, she said that was very crucial when you go in, and I think that is something that we all would struggle in as new PTAs. The fact that she's been in the field for over 8 years shows her dedication and her passion for the career. And the patient population, it's both different in age and in treatment, since this means you can gain knowledge and experience from each and every patient. Prevention of stroke. There are many things someone can do in their daily lives to minimize and reduce their chances of stroke. Things such as lowering blood pressure, maintaining blood pressure less than 120/80 if possible. This would be achieved by reducing salt in your diet, eating more fruits and vegetables every day. Blood pressure is the leading factor that can double or even triple your chances of stroke when high. Exercise. A person should aim to exercise at least 3 times a week for 30 times a day. Exercising and maintaining your weight can also contribute to lowering your blood pressure. Limiting your alcohol intake. Drinking is okay. It may even help prevent stroke when it is done in moderation, but not in excessive. Do not smoke, because smoking can accelerate clot formation. It can thicken your blood and increases the amount of plaque buildup in the arteries. And to treat AFib, atrial fibrillation is a form of heartbeat that causes clots that form in the heart. Those clots can travel to the brain, producing a stroke. Xavier is now going to be presenting his slides.
Hello, research of the selective physical therapy setting a long-term would be at a hospital. Overview of patients and condition in that setting. We mostly receive patients from ages from 45 to 80 will be treated by the neurohabilitation therapists. Clearly describe the physical therapy setting based on the interview and article findings. When a resident or patient gets a stroke, a CT scan is performed to determine whether the etiology of the stroke is ischemic or hemorrhagic. This will determine what type of treatment the patient will receive. Recovery in stroke. Based from the information provided, recovery from a stroke occurs rapidly during the first 3 months. The pace is slower to reach the patient's maximum recovery over time. Post-stroke physical therapy interventions are designed to enhance recovery of task-related functions to achieve their goal. The patients will learn the motor activities again, such as walking, sitting, laying down, and standing. Presentation relates to information obtained from research finding and interview. Patients that receive therapy will grow patients to recover from their stroke. Now my partner Brianna will continue with her slide.
Okay, so some signs and symptoms for stroke that we can be on the lookout. I did put 4 signs and symptoms, which is the first one can be sudden numbness or weakness in the face, in the arm or leg. Remember, it can be on one side of the body. The second one will be sudden confusion, trouble speaking, or difficulty understanding speech. The third one will be sudden trouble seeing in one eye or your both eyes. The fourth one will be sudden trouble walking, dizziness, loss of balance, or lack of coordination. 2 treatments for stroke patients can be the following. The first treatment can be the motor skill exercises, which can help the patient improve the muscle strength and coordination. The patient will have therapy to strengthen the patient with swallowing. Some motor skills can even benefit from them, which the motor skills exercises can be self-care skills such as dressing or maintaining a good hygiene. The second treatment can be mobility training, which the patient might learn to use mobility aids such as a walker, canes, wheelchair, or an ankle brace. For example, the ankle brace can stabilize and strengthen the patient ankle to help the support the patient's body weight while the patient is learning how to walk again. Okay, so these are our references that we got our information from. If you have any questions, please comment below. Thank you.
Thank you.
Okay.